MRI. You are listening to the audio brochure MRI. You have an appointment for an MRI scan. The examination will take place at the Radiology Department of the VU University Medical Center. Please report to the reception desk U on the 4th floor of the outpatient building, or location 2A 39 on the 2nd floor of the hospital building, or the reception desk F on the ground floor of the outpatient building. Safety precautions. Please take care to listen to the list of questions in the final part of this audio brochure, even if you have undergone an MRI scan before. Please refrain from taking metal objects into the examination room, as these may interfere with the examination or can pose a risk. You can leave these objects and your other possessions in the changing room. Under no circumstances may you bring the following objects into the examination room: cards with a magnetic code, such as ATM cards and credit cards. These can be rendered useless. Coins, jewelry, watches, cufflinks. Hearing aids. Other metal objects. Eye cosmetics may also contain metals. If you are coming in for a head MRI scan, please refrain from putting any makeup on your eyes. More information regarding safety during MRI examinations can be found at www.mrisafety.com. The MRI scan. MRI, or magnetic resonance imaging, is a technique which produces pictures of the body without the use of surgery or X-rays. The MRI scanner uses a powerful magnetic field and radio waves to create cross-sectional images of your body. The procedure is painless, without side or after effects. Preparation. In general, undergoing an MRI scan does not require following a special diet or any other guidelines. If not, we will inform you beforehand. The examination. The MRI scan takes place in a room with a powerful magnetic field. One lies on a table that will be moved into the scanner during the examination. This is not an enclosed space. If you are claustrophobic or feel uncomfortable in small spaces, please contact your attending physician. During the examination, it is vital that you relax and lie as still as possible, as any movement will negatively affect the results of the examination. The noise you hear is due to the scanner coils being turned on and off. This is the normal sound of an MRI scan. The duration of the MRI examination depends on the information required by your attending physician. The scan can therefore take between 30 to 60 minutes. During the examination, it is sometimes possible to listen to music. If you wish, you can bring your own CD. Contrast medium. In order to visualize certain organs, the use of contrast medium may be necessary. If so, an IV line will be inserted, through which the contrast medium will be administered during the MRI scan. Apart from the prick of the needle, this is painless. The use of contrast medium during an MRI scan has been regular practice for many years in order to enhance the results of the scan. It is considered very safe. Side effects rarely occur. If you have a history of adverse reactions to contrast medium which require treatment, your attending physician will prescribe medication to be taken prior to the examination. Shortly before the scan, you will be administered another type of medication. This medication may affect your driving and concentration skills. The effect may last up to 12 hours. Therefore, please bear in mind that you may not drive a car after the examination. Ask somebody to accompany you. If during a previous examination you suffered any complications, such as those mentioned above, which were not discussed when you made your appointment, please contact your attending physician. Questions. Please contact your attending physician or a physician from the MRI unit of the VU University Medical Center Radiology Department if you have any questions. Contraindication questions for an MRI exam. Please listen to the information brochure first. Information. MRI is a technique which uses a powerful magnetic field and radio waves. In some cases, this magnetic field can be dangerous. To exclude all risks in this respect, please listen to the following questions. Not including the first question, if you answer one of the questions with yes or I don't know, please contact us at 020-444-0696 before your exam is due to take place. Have you ever had an MRI exam? Do you have a pacemaker or old pacing wire? Do you have clips in your head from surgery? Do you have a medical pump, such as an insulin pump? Do you have a portacath? Do you have a neurostimulator? Do you have an intraocular lens fixated with metal clips? Do you use a hearing aid? Do you have metal pressure equalization tubes or an ossicular replacement prosthesis? Do you have an inner ear cochlear implant? Do you have any prosthetics, such as prosthetic limbs? Do you have one or more piercings? Do you have one or more tattoos? Do you have metal dental braces that cannot be removed? Do you have difficulty lying still for over 30 minutes? Have you undergone surgery in the past 6 weeks? Have you undergone capsule endoscopy, and has the capsule not passed through your body yet? Do you have an implantable cardioverter defibrillator? Are you a former metal worker, or is there any chance of finding metal fragments in your eye sockets? Are you claustrophobic, fearful of small spaces? Do you suffer from shortness of breath when lying down? Before the start of the exam, please tell us your weight in kilograms. Question for women. Are you, possibly, pregnant? Radiology Department, MRI, phone number 020-444-0695. VU University Medical Center, October 2012, www.vumc.nl